There are a couple challenges that relate to using the current EMRs in an accountable care organization. And I think probably the first one is that most data in electronic record is in unstructured formats, and to use the data, it's really better to be able to have data in structured fields. So an example of that would be the exact score on an HbA1c for diabetes, for example. What isn't always in a structured field is that the patient has diabetes with nephrology or other complications. That may be in a note. So actually being able to find the unstructured data is pretty cumbersome. We've actually worked at developing tools that help deal with that in two ways. One, to identify the data and present it to clinicians and to coders and stuff like that. And the other is to figure out how to pull the data out so that in some cases where it's really important to actually put it into structured fields. So that's helped us a lot in that regard. The other issue is that as we get more sophisticated in our decision-making tools, the structured data tends to force data into very defined pieces. And so you lose the continuity of the data. So you may say, the score is 15 or 15.2, but depending on the test, it might be much more meaningful to say it was 15.23 or something like that. And, in some cases, that loss of specificity is a problem. And to deal with that, we've begun to use graphics a lot more in terms of test result presentations and things like that. So I think those are a couple of ways that help bring the data that's in the electronic record to a meaningful use for the clinician.